Hi, I am Angie Lehman. I am a former registered dental hygienist and a certified orofacial myologist, and I'm the owner of Oral Myofunctional Therapy of York in York, Pennsylvania. The first time I took one of Walt's manual therapy classes was back in July of 2022, and I recently hosted and took it again and was his teaching assistant here at my office in York in September of 2024. So I've taken Walt's work twice now, and I feel like every single time I hear Walt present, I come away with new fantastic information to use with my patients. Before I took Walt's class back in 2022, I had been doing manual therapy for a while. I actually had been doing manual therapy even long before I was a certified orofacial myologist, because years ago when I was working as a registered dental hygienist, I would have a lot of patients that would come in with a lot of temporomandibular joint issues, and it was really hard for them to stay open for an hour in my chair. And so years ago, I had some training in manual therapy, and I would just do a couple of quick releases, usually for masseters and pterygoids, just to help give those patients a little bit more comfort as they were in the chair there for their dental work. And I've always loved this type of work. I've always felt that it was really, really impactful. You can get a lot done in a short period of time, and it can really make a positive impact on the comfort level for your patients. So fast forward to many years later, and I am now a certified orofacial myologist. This is my 13th year just practicing orofacial myology, and I've taken a couple of manual therapy classes, and each time I take a class, I feel like I learn some really, really great information. But the one thing that's always been missing in a lot of the classes that I've taken is that whole patient-centered approach, where our goal as the therapist is not, I'm going to do this to you and make you feel better, but rather, how can we work together? How can we communicate? How can we come up with a plan that feels beneficial and feels relevant for the patient and feels helpful for them, rather than me as the practitioner sort of trying to perceive exactly what I think is going to be helpful for them. And I feel like that's really a game changer for a lot of therapists, because we are taught to really just do our work to our patients, and we sometimes forget that we really need that input from the patient, that patients have autonomy and they should really be a critical part of their own treatment plan. And so I really feel like adding that piece into what I've already been doing has really, really been a game changer. Typically in our office, we see children and adults, and I find that this work is incredibly beneficial for the temporomandibular joint patients that we're treating today. We're doing myofunctional therapy, we're adding different layers of treatment to their treatment plan. But I strongly feel that so many of these TMD patients need that hands-on approach. They really benefit from that personal touch, and then just adding in the layer of making sure that it's something that they have a part in really makes a big difference. So if you're kind of on the fence and you're wondering if this is a class that is going to be beneficial for you, I can't recommend it enough. Walt is a phenomenal teacher. He just brings such a level of expertise to this subject, and I feel like no matter what your background is, whether you're a speech and language pathologist, a dental professional, a physical therapist, a massage therapist, you will walk away after the 2-day class with a lot of things that you can immediately implement into your practice. So I would really encourage you to pull the trigger on this one. It's a fantastic class, and it's been a privilege to learn from Walt in my own journey.